I'm Dr. Chris Schock. Today I'm going to speak about herpes zoster, also known as shingles, a very common reactivation of the chickenpox virus. Let's talk about herpes zoster or shingles. Well, here you can see pictured an example of shingles. Well, just what is it? Well, what happens is that when we're usually children, we contract chickenpox or the varicella zoster virus. Well, this virus lives with us for our lifetime once we have it. It lives in a region of the nerve called the dorsal root ganglion. Well, reactivation of the chickenpox virus causes shingles. Why does it happen? Well, again, the virus lives with us for the rest of our lives. Well, a decrease in cell-mediated immunity leads to reactivation of the VZV virus. It travels along the sensory nerves, so the nerves that give sensation. It starts along the spinal column, and then it travels along this nerve, causing pain and nerve damage as it travels along that nerve, and eventually makes it to the skin and causes a rash. Well, why does it come out? Well, most commonly it's because of aging. As we get older, we become at increased risk due to the natural senescence, the natural aging of our immune system. We become at increased risk for reactivation of this virus. If you are on immunosuppressive drugs, let's say you're an organ transplant patient, or you have a chronic inflammatory skin disease, or any type of chronic inflammatory disease requiring immunosuppression, you're at increased risk for shingles or herpes zoster. Well, how does it present? Well, often people have a flu-like illness for several days or even a few weeks prior to breaking out in the rash. Usually they'll get dermatomal pain. That means pain in the region that sensory nerve controls. So a sensory nerve will control the sensation for one side or one region, a circumscribed region of the body. Well, usually there's pain but no rash for the first 2 or 3 days. Later, it erupts as a hive-like rash, and eventually it can progress to blisters. Sometimes they're hemorrhagic or bloody blisters. It's important to note that it's in one region and it does not cross the midline of the body. Eventually, again, blisters evolve, and it's quite painful in most cases. There are a few subtypes or regions where herpes zoster can be a little more dangerous. Herpes zoster oticus. Well, this is shingles or zoster of the face and in particular the ear. The reason this is so important is because it involves the V3 branch of the trigeminal nerve that controls sensation for a region of the face along the jawline and ear. And it can also get into a nerve called the facial nerve, which controls movement for the face. So when zoster oticus evolves, one, it can lead to deafness. Two, it can lead to a one-sided facial paralysis. So it's very important that we identify zoster in this region and treat it early because we can decrease the chance of facial paralysis and deafness by early therapy. Another region that zoster can be important to treat early is herpes zoster ophthalmicus. What that means is that you have zoster that involves your eye. Well, here you have pictured Hutchinson's sign. Well, if you have blisters on your pain first, and then blisters evolving on your forehead, around your eye, and in particular your nose, that is an indication that you have involvement of the V1 distribution of the trigeminal nerve. Anyway, it's the nerve that controls this region of our face, and it can get into the nerves around the eye and cause blistering, and it can cause blindness. So again, early detection of herpes zoster ophthalmicus, very important. Other regions that zoster can occur is across the left side of the chest. It can be thought to be a heart attack in those cases where people are having pain across the left aspect of their chest, and then later the rash develops. Well, again, postherpetic neuralgia is another complication of herpes zoster. What that means is that you have pain in the region lasting greater than 6 weeks. So the longer and more severe your rash is present without therapy, the greater your risk tends to be to have persistent pain in the area. Also, the older you are, the more likely that you'll have some persistent pain. So you can imagine that as this virus travels along the nerve, causing nerve damage, that can lead to very prolonged pain. Nerves don't repair themselves very well, and so sometimes post-herpetic neuralgia can last for months or even years in some cases. Fortunately, there are some therapeutic options, and you can access those options on our website or watch our post-herpetic neuralgia video.